Is it, what does it mean? Can it be that if I am on prescription by my doctors, my pharmacists, can we also have abuse and misuse on where prescriptions have even been made?
Of course, of course. Let me take the opportunity to explain this. We have used the term misuse and abuse interchangeably, but they are different. When we say you are misusing drugs, then you are not taking the drug according to the prescription that you were directed by either the pharmacist or the nurse or the doctor. So you are using it outside what you were directed to do, right? In other words, the purpose for which you were given the drug is not what you are using the drug for. Or you have ignored the instructions and you are doing your own thing. And that happens with prescription drugs, just as you are saying. And that is a clear issue of misuse. Let me give you a few examples. When you are given a prescription, there are some important things, Reverend, that you have to note. And that is going to help you for the drug to work so that you get a full benefit of the drug. The first one that you have to bear in mind is so important is the dose. In other words, the amount and the quantity that has been directed by the physician or the pharmacist or the nurse. You deviate from the dose by taking an underdose or an overdose, you are in trouble. Overdose is going to give you side effects that sometimes it becomes so overwhelming that you need to withdraw the drug. And when you take an underdose, it's not going to work. So the dose has been carefully selected in such a way that you have full benefit of the drug. Apart from that, the time to take the drug is very important. The frequency and then the duration of action, the duration that you have to take the drug. Is it 1 week? Is it 2 weeks? Is it 5 days? That is also very important. And that will determine whether you are going to benefit from the drug or not. Sometimes, Reverend, we are giving medications, prescription medications, to take for 1 week. We take for 3 days. We are well, and therefore we leave it. And I dare say that for people who are busy, maybe your wife will look into your jacket and find that you have remnants of medication that you have been given, but you haven't finished taking because you were well. All right. And sometimes what happens is that because these drugs are available, maybe my symptoms are similar to your symptoms. So you tell me, oh, Kwesi, I'm not well. I said, oh, what's wrong with you? I describe it and say, that is the symptoms that I experience. So I'll give you some of the medication. We are abusing it. It's not meant for you, all right? So we are abusing it. And I think these constitutes misuse, especially with prescription medicines. When it comes to abuse, abuse is entirely different. Remember that when it comes to prescription drugs, you are taking it for a specific ailment. When it comes to abuse, all right, you are taking the drug not for a specific ailment, but because you want to enjoy certain aspects of the drug. So you can get euphoria out of it, excitement out of the drug. And that is the main reason why you are taking the drug. It is abuse. You don't have to take it. There is an overlap. Of course, if you are taking antibiotics and you are not taking it according to the instructions given, you may describe this as an abuse. But let me give you the difference between misuse and abuse. In misuse, there is a definite intention to take it for a specific purpose. But when it comes to abuse, you want to take it for recreational purposes. You want to feel high, all right? You want to enjoy the euphoria. You want to enjoy the excitement. And that is mainly associated with hard drugs. So that's the difference.